Aloha everyone, and welcome to the Hawaii Pacific Gerontological Society's November webinar. I am Mapuana Ta'amu, one of the board members for HPGS and also chairperson for these webinars. A little background on HPGS. It was organized in 1979, and Hawaii Pacific Gerontological Society is a nonprofit organization that is dedicated to improving the quality of life of Hawaii's older adults. We promote the understanding of the aging process, supportive services, and also legislation that help people age with dignity and grace. If you haven't already, please consider becoming a member of HPGS so that you can stay updated and invited. Check out our website at hpgs.org for more information under the membership tab. Also, this webinar will later be posted to our website, so you can also check there later on. I'll also send you invites to check it out when I post it. All right, so let's get down to business. We have all gathered here today to talk about Medicare health insurance and drug prescription enrollment options. I want to send a huge thank you to the many of you who have submitted personal questions that you have about Medicare. We will get toward those towards the ending of this webinar. But if you do have any other burning questions, there is a chat box that you may use to type in your question or comment throughout the presentation. You can't see me, but I am actually well below Medicare age, and that doesn't stop my desire for learning about it. So I've invited a special guest with expertise in the field to educate us about open enrollment and Medicare health insurance. Our speaker today is a lovely Terry Peacock. She has an extensive background in the health industry and assisting hundreds of clients through the years with their healthcare planning and insurance needs. She has worked with Kaiser Permanente for 15 years and served as marketing director at Kahalanui Senior Living Community during the project's development years. Presently, she is an insurance advisor with Mutual of Omaha's Hawaii division, and she is an authorized licensed representative for Humana and United Healthcare Medicare plans. Terry holds a master's degree in education from the University of Hawaii, and she also taught in the public school systems for several years before changing careers. So Terry, thank you for being here today.
Well, thank you all for taking time out, especially during your lunch hour. I realize that many of you may not be of Medicare age like Mapuana, but you work with people that are of Medicare age and beyond, as well as perhaps family members. So today we're going to cover a wide range of subjects, and some of them may not pertain to you, and other areas may. So I do want to invite you we're going to have a lot of information today. So I want to invite you to give me a call if there's one area in particular that you want to go into further detail. And also you can go on their sites, and the slides and the presentation will be posted if you wanted to review any of the information that I'm sharing today. Some of the areas that I'm going to be covering will be, since it all starts with Medicare, we need to enroll in Medicare. When do you enroll? What parts do you enroll in? What are the penalties if you don't enroll? So you have Medicare's A, B, C, D, and I'll be going over what that alphabet stands for. You also have coverage. What is the coverage of traditional Medicare? So if you don't have a gap coverage or you don't have an Advantage plan, what would you have if you just have traditional Medicare? Also, there's a lot of confusion, especially with my clients. What is the difference between a Medicare Supplemental plan and a Medicare Advantage plan? And we'll be covering that as well. And also, we are in the midst and at the tail end of annual AEP. That's the annual enrollment period for Medicare Advantage plans and prescription drug plans. So we're going to be going through the process that the clients can go through in evaluating if they should stay where they are or if they should change plans. So it's a very important time of year for a lot of your clients as well. And then because there is a lot of confusion, People sometimes use the word Medicaid instead of Medicare. I'm going to have my Medicaid coverage, and I always have to correct them and say Medicare. We're going to talk a little bit about Medicaid as well, and how Medicaid works with Medicare to provide those on Medicaid with medical insurance. So as you can see, there's quite a few things to cover. I'm going to try to do it in a clear and concise manner as I can, but it is a complex subject and there's no way to get around it. But we're going to start with what is Medicare. So we're going to start real basic. We all know that Medicare is a health insurance program operated by the federal government. And benefits are available to qualified individuals age 65 and over. Now, many of you may say, oh, I know somebody who's under 65 and they have Medicare. How did that happen? Well, they may have just be receiving disability insurance, SSI. And so someone who is disabled and they've been on SSI for 2 years or more will automatically be enrolled in Medicare. So sometimes you will run into a client, a friend, an individual who's under age 65 who is actually covered by Medicare. Also, if they have ALS, then they are eligible the month that their disability begins. And also if they have end-stage renal, ESRD. So traditional Medicare consists of two main parts, and that's Part A is hospital insurance, and Part B is medical insurance. So Part A is when you're in the hospital, all of the services that are done, the labs, the x-rays, the surgery, that's all covered under Part A of Medicare. And Part B of Medicare is your outpatient services, such as the doctors, the x-rays, and the lab test. So for 2018, if you only had traditional Medicare, there would be a deductible of about $1,340 in the hospital, and that will be going up a little bit to $1,364 in 2019. So you see, if you only have Medicare and you're hospitalized, you would have to pay quite a large deductible before Medicare would start paying for your room and board. And that's where these additional Medicare private companies come in to pick up those gaps in Medicare coverage. Also in Part B, you have the yearly deductible of $183 for outpatient services, and then thereafter it's covered 20%. So if you did not have an additional Medicare supplemental plan or Advantage plan, you would need to pay 20% of the services of in a physician's office or lab, x-rays, etc., after the deductible of $183. Every year that deductible goes up. So next year, that deductible will be $185. So what these additional plans cover is part or all of the deductible and part or all of the 20% that Medicare would cover. Now, how do you prepare? That's important for Medicare. And when do you sign up? So it's not something that after you turn 65, 3 months later, you realize, oh, I should have enrolled in Medicare. There are time limits to that guaranteed coverage. And you want to sign up for Part B as soon as you are eligible. And that would be 3 months before you turn 65 and 3 months after you turn 65. But most people want to have it when they're 65 so that they have coverage, medical coverage. But if you do miss that, you still are eligible to sign up without a penalty 3 months after you turn 65. Now, Part A, which is the hospital part, is automatic. So regardless if you're working or not, you will be signed up for the hospital coverage. So you want to have the hospital coverage, but if you are still working, you can delay having the Part B coverage, and if you're covered under your employer plan. Let's see where we see. So we see there secure. Now after, because there are gaps in Medicare, if you're not covered under an employer plan, you want to make sure to secure either a Medicare Supplemental plan or a Medicare Advantage plan. There will be no medical questions. So during this period, it's a very important period that you would have to join a plan regardless of your health. They won't take that into consideration. So guaranteed coverage means you just sign up, and it's a very simple process. So that's why you want to make sure that you're signing up during that guaranteed period. Medicare Part B, let's look at the cost and the penalty. So Medicare is not free. Medicare Part B, there is a premium, and it's a monthly premium. And this year, it's $134. Next year, it will be $135.50. So that's why some people will not sign up for Part B of Medicare, because they say, I'm not sick. Why do I need to spend $135 a month? I hardly go to the doctors. Well, they don't realize that as time changes, their health will change as well. And now they want to enroll in Part B, and now they have a 10% penalty that is imposed for each full 12-month period that people delay enrolling in Part B. It's a pretty stiff penalty. So no longer would it be $135.50 if they delayed it for 2, 3, 4 years. The penalty is waived for Part B if you are covered by a group or employer plan. So those that are still working after 65, you can delay enrolling in Part B. You don't have to pay the $135, and you can continue on your employer plan. Sometimes the employer plan is more expensive than having Medicare and a Medicare Advantage plan. So sometimes you need to look and see if it really still makes sense to stay on your employer plan by comparing the benefits and the cost. Now remember that I did say that Part A is free for those who qualify. See if we can go on. Here we go. Okay, so we covered Part A and we covered Part B. Now we're going to talk about Part D. And Part D is in drugs. So you need to enroll in a prescription drug plan from a private company in addition to Part B. If you delay, again, there's a 1% penalty each month of the delay. I run into many clients that have delayed enrolling in the Part D benefit, and they are paying that penalty. At the time, they weren't taking any prescription drugs, so they said, I'm going to save money and not enroll, without knowing that there is a penalty for late enrollment. So you want to encourage your family, your friends, your clients to enroll in Part B and enroll in Part D as soon as they're eligible if they are not getting medical benefits through their employer. Now they would look at also a Medicare Advantage plan that includes Part D. So they wouldn't need a standalone plan if they enrolled in a Medicare Advantage plan. That also satisfies the requirement. So the Medicare Supplemental plans however, do not have a drug plan associated with them, so they do have to enroll in a standalone plan. So we're going to talk a little bit more about the difference between those two plans in a few minutes. So Medicare Advantage plans are now under Part C of Medicare. I don't know what Part C stands for because it's not the alphabet of Medicare Advantage plans, but it is Part C. And this is private health insurance companies. They administer Medicare for Medicare, and they administer the Part D, and they include additional benefits. So it's an all-in-one plan with one card. Medicare likes that because they pay the health insurer per member per month for whatever the cost is for their age in that region in the United States. So they know what their costs are going to be. Now it is up to the health insurance company to manage the health. And that's why you'll see so much emphasis on preventive care, because the less their members pay for use medical services, then they will have more money left over in their plan, for people who are high utilizers of services. So if they're only attracting the high utilizers of services, that capitation rate from Medicare will not be enough to make that plan viable. In addition, they provide coverage of all or part of the 20% or the deductibles. So remember I told you those upfront deductibles, you won't find them in a Medicare Advantage plan. They may have a co-payment for a doctor office visit. It could be $0, it could be $10, depending on what plan is chosen. But very rarely is there an upfront deductible. In Hawaii, I don't know of any plan, Medicare Advantage plan, that is charging any upfront deductible before they pay for any medical services on the outpatient basis. They use a network of doctors, so you can have Medicare Advantage plans that are HMOs, like Kaiser's an HMO, they have a Medicare Advantage plan. You can have PPOs, you have HMSA, you've got other carriers like United Health and Humana that have a variation of either PPO or HMOs. And they all include prescription drug coverage as part of the plan and the monthly premium, if any, because some of these Medicare Advantage plans have $0 premium. In addition, a Medicare Advantage plan has a lot of value-added services. They include silver sneakers. They want their members to be healthy, so go to the gym and work out, and we'll pay for your gym membership. They have a 24-hour nurse line, and they're adding dental and vision coverage as well into their medical plan at no additional cost. So those are the Medicare Advantage plans. They incorporate the Medicare benefits and administer the Medicare benefits with their own plan. And Medicare is out of the picture, and they just pay a capitated rate per member per month to the health plan. So it's a different contract. And because Medicare Advantage plans are administering the Medicare Parts A and B, Medicare has really put a lot of regulations into these plans, and they rate them by stars on customer service. What kind of preventive outreach are you doing for your members? So you'll see that there's a lot of additional services in the preventive areas in these Medicare Advantage plans. The Medicare supplemental plans do not have a contract with Medicare. They're completely separated. So Medicare, it's called Medicare Gap plans, and they are independent. So Medicare would be primary, and then the insurance, the private insurance company's Gap plan would be secondary payer. And then whatever is not covered by both of those plans, then the client would be billed. So they pay a portion of the A and B deductible plus the 20%. And there's no provider networks. So people that travel a lot, if they are snowbirds, they live in Hawaii and they go to the mainland for months out of the year, a lot of them would prefer the Medicare supplemental plans because there are no networks and they can go to any doctor that accepts Medicare in the United States. They can see specialists without referrals. And they have a wide choice of plans and premiums. So you'll hear an alphabet like plan A, B, C, G, F. All of these alphabets stands for a standardized benefit that Medicare has outlined. And all of the plans regarding whatever carrier clients go to, they will have exactly the same benefits with that carrier if they chose a plan G as they would with another carrier. The difference would be perhaps in some of the additional services and the administration of the plan, the company, the stability of the company, and most importantly, the premium. So you can have a company that offers a plan F for, like $200, and you can have another company that offers the plan F for $150. So there's a lot of shopping that can be done to for the beneficiary to look at what would be the best Medicare supplemental plan for them. The Medicare supplemental plans do not have a yearly open enrollment period except during that qualifying event of aging in. That is guaranteed. If they did not take a Medicare supplemental plan during that time, and they took a Medicare Advantage plan, and then later on they wanted to change to a Medicare supplemental plan, then they will have to answer some medical questions. And if they have a serious illness, they could actually be denied or the premium would be increased. So that guaranteed period is very important. There are other times that people can have guaranteed enrollment, like if they move from one area to another and the plan is no longer available in the new area, then they can change. So that would be considered a qualifying event. Or if their company is no longer in business, that's a qualifying event. So all the other plans have to have that guaranteed enrollment clause. So original Medicare Parts A and B would pay first, then the private insurance, and then whatever's left over, depending on what plan they chose, would be billed to the customer. Now, Medicare open enrollment, as I mentioned to you, we are in tail end of Medicare open enrollment. It's every year at the same time, October 15th to December 7th. Now, this open enrollment period only pertains to Medicare Advantage plans and Part D standalone drug plans. Clients can change plans for the following year. And why would they need to do that? Well, perhaps their particular plan had a rate increase and another plan did not, or the benefits changed and the areas that they were most interested in are no longer available, or they have changed the co-payments. So every year it would behoove the who we call the member, the beneficiary, to check other plans and see if there's other plans that would better suit their needs. Or if they stay where they are, then they do not have to take any action at all. And they can compare plans through Medicare.gov, or they could go to their agent of the insurance companies and talk about, what they don't like about their plan, and we can help them do a comparison. The senior marketing protections, I put this down because I wanted you to know that the agents that sell these Medicare plans, the Medicare Advantage plans, there are very strict requirements, and there is a lot of training that needs to be done for them to be certified every year. We have to be certified by Medicare. We have to know Medicare inside and out. And then the individual plans also have their own training about their benefits and what an agent can or cannot do. So I wanted you to know that the seniors are very well protected from unscrupulous agents that may be a little bit too pushy. So first of all, we can't even discuss the plans until October 1st. So if somebody called me and I may have an insight into, I might know in September that there's going to be certain changes. I really can't talk about it to my clients until October 1st. And I can't accept an enrollment card until October 15th. So there's very specific times that you can accept enrollments. There's no cold calling of seniors. So, if I with life insurance, et cetera, you can pretty much go through the telephone book and call anyone if they answer the phone and say, are you interested in life insurance? You can't do that with Medicare Advantage plans. You can send emails. This year, they allowed that. If you have an opt-out in your email, that if they no longer want to receive emails from you, then they can just opt out of that and you won't send them any more emails. And the mailers that are received have to be approved by CMS, which is the Center for Medicare Services, and by the plan that the agent represents. So they just can't send out any flyers and just make up their own words. It all has to be approved. The senior it has to initiate the call, and if they attend a seminar or something and they want me or an agent to call them back, they actually have to sign a contact form which would say, I approve that this agent is going to call me. We may not approach seniors in person. So if there is a kiosk or a table at a mall or in one of your facilities, we wouldn't be able to approach the seniors. They need to come up to us and ask questions. So in the care homes, if you want to have an agent there, it's very good so that they can answer questions for your residents. But it needs to be outside of the caregiving areas, such as the dining room or the lobbies. And the resident needs to approach the table. We can't say, hey, come on over, I have a free gift, and here's a brochure. That's not allowed. So it's very different than your normal marketing. Also, before we have an appointment with a client, we need to have them sign what is called a scope of appointment form. And they would initial exactly what we're going to talk about: Medicare Advantage plan, Medicare Sup plan, drug plan, dental plan. We are not allowed to talk about any other product in that meeting but what was checked off. And a full presentation must be conducted, and we're all trained in what a full presentation consists of. and the benefit summaries, the materials that need to be presented, all of that is structured that we need to abide by the structure of the presentation. So as you can see, there are a lot of requirements and restrictions that are meant to protect seniors so they're not bombarded during this time. Now, what's important is that there are several things. We've talked about what is covered, but we haven't talked about what is not covered by any of these plans, or specifically by Medicare. Prescription drugs, it was not part of Medicare Part A and B, so it's sold separately either through Part D or an Advantage plan. Long-term care is not covered by the Medicare only, traditional Medicare, or by a Medicare Advantage or supplemental plans. So when you have a individual who is chronically ill and needs to be taken care of, no longer can live independently, there is no medical coverage that would cover that custodial care. They would need to purchase additional insurance earlier before they needed the care through either long-term care insurance or through a life insurance plan that had a long-term care insurance rider. There are various ways now that people can protect themselves from the cost of long-term care through other vehicles. It is not going to be through the vehicle of their medical insurance. As I mentioned, there's deductibles and co-pays with traditional Medicare. You're going to have co-pays with your Medicare Advantage plans as well. So seniors really need to set aside some savings to cover some of these co-pays because nothing is fully covered anymore. Dental is not part of Medicare. So in the Medicare Advantage plans, they have a lot of preventive and they'll cover cleanings and fillings, but no large bridges and caps and things like that. So they need to look at a dental plan if that's important. Routine eye exams are not covered under Medicare, but the Medicare Advantage plans are incorporating benefits into cover all or part of eye exams. And they also are incorporating a dollar amount towards the cost of lenses and frames. Hearing aids, hearing exams are not covered under Medicare, but the Medicare Advantage plans are now incorporating the exams and hearing aids into their benefit programs. And then all of the plans, there's limited coverage when traveling outside the US. So you may be covered initially for like the first 60 days for emergencies, things like that. But people who are going to be traveling for a long period of time may want to look into additional coverage through travel insurance because your Medicare or your Medicare Advantage plans are not going to cover very much. As I had mentioned earlier, there is some confusion between Medicare and Medicaid. They sound alike, they look alike, they both start with M's. So let's just review a little bit about Medicaid and how that works with Medicare. So Medicaid is a state and federal program together for the financially impoverished. And remember, Medicare is federal, it is not state. It combines medical coverage with Medicare benefits when individuals qualify for Medicare. So it covers also long-term care, usually in foster homes or skilled nursing facilities. So Medicaid has a little more, if you qualify for Medicaid, you're also getting additional benefits with that traditional Medicare will not cover. So Medicaid is a means-tested program monetary and asset limitations in order to qualify. And most of you will know there's that 5-year look back on asset transfers and spend downs. So you can't automatically sell off everything just to qualify for Medicaid, for long-term care, then, immediately. Medical benefits are administered, we know it better here through the Quest Managed Care Plans. And these are called dual special need advantage plans. So the dual special need advantage plans, there's 3 types. There's the, for chronic illnesses, that's the CSNP, chronic special need plans. Then there's dual eligible, meaning they're eligible for Medicare and Medicaid. And then there's institutional. And they have special benefits and a lot of more care intervention and care coordinators. They get some nursing services in their home. There's a lot of additional services and ancillary services that these dual special need programs offer. It's really quite amazing, the additional benefits and the individual coverage that they will receive if they're on one of these plans. And then annually, the eligibility renewal requirements will be looked at to make sure they're eligible to continue on this Medicaid, Medicare plan for the next year. And most of these plans do include generous drug, vision, and dental benefits. Now, there is additional help for low income. I thought you might be interested in some of these programs, and I'm sure that a lot of you are familiar with them, and a lot of the social workers that work with low-income people will know exactly what they need to do to get extra help. So one is called the Low-Income Subsidy. It's also known as Extra Help. Now, Extra Help will pay for co-payments and deductibles on prescription drug plans. And they can get a full subsidy of 135% if they're under 135% of the federal poverty level. So that means if they bought a prescription drug and the co-payment on that particular type of drug was $100, then Extra Help would pick up that $100. And if there was a deductible on that type of drug, maybe it was called a Tier 3 drug where there can be deductibles, Extra Help will pick up that deductible. And there's Extra Help can be fully subsidized, the cost of the drug, or it can partially subsidize depending on the person's income. So if it's partially subsidized, then the individual would pay about $83 deductible and then 15% of the out-of-pocket cost. They can apply online at socialsecurity.gov/extrahelp. When they do apply online or over the phone, and there's a number 1-800-772-1213, that information is automatically transferred to our Medicaid offices here in Hawaii to see if they may qualify for Medicaid or some additional programs. But this would be through Social Security, not Medicare.gov, because Social Security handles, they'll know the income of the individual and if they qualify. There are other Medicare savings programs that help pay for the Medicare Part B premium. So as you may remember earlier in my presentation, I said that there was a premium for Part B, and it's going to be up to about $135 or so in 2019. Well, there is a program, depending on their income, where Medicare, Social Security would actually cover these Medicare savings programs would cover that Part B premium. They may also pay for some of the deductibles and co-payments in Part A and B if that's all they have. And Social Security, as I mentioned, will send information to your state when you apply for extra help program. And you must enroll Medicare saving programs through the state Medicaid office. So after you do the extra help and then you find out you might qualify for Medicaid, then it becomes a state qualification, and then you need to go through the Medicaid, the state Medicaid office here in Hawaii. So in conclusion, if I haven't totally confused you, let's just review that Medicare coverage is the first step in securing medical insurance upon turning 65. And then in addition, you do need to enroll in a Part D, and that Part D could be through a Part C plan, which is Medicare Advantage, or you do a standalone drug plan and enroll in a Medicare Sup plan. And the reason why you want to have additional private insurance plan is to fill in those gaps in coverage of Medicare that I went through. And Medicare and private insurance plans do not cover all medical costs, and they do not cover long-term care. So even if you feel you have the best coverage, you're going to find areas that there are still going to be some pretty serious co-payments or charges if you do not have any of those additional coverages for low-income people. So for financial management, you really, as you age, need to set aside money to cover some of these benefits, because in order for the health insurance programs to remain viable, sometimes they're going to have to increase those co-pays, or they may have to increase their premiums to keep up with the cost of the medical care of an aging population. So that concludes my presentation, and we are open to any questions. If I have some people remaining during this talk and you haven't tuned out. So Mapuana, do you know if there's any questions?
I am trying to open the chat box. So if anybody does have questions, please enter it into the chat box.
I might add, again, if you need to get in touch with me, if you want any clarification or any more information, my cell phone number is 808-372-7297. And I'll be glad to chat with you and help you in any way I can. You can also reach me at tspeacock at hawaiiantel.net. That's tspeacock at hawaiiantel.net. Thank you.
Also, if you, hi, I'm Mapuana Ta'amu. If you do have questions and for some reason can't get in touch with Terry, you can also send us an email at hpgsmembers@gmail.com. And I can forward you any information. The slideshow will be available on hpgs.org. So please check us out there. Within the next week, I will be uploading this presentation so that you can share it with your friends, your family, save it for next year if you want to. But it'll always be there on hpgs.org for future reference. Thank you, Terry, so much for coming today.
Thank you for having me. I appreciate it very much.
Yeah, and I'm sure we all learned a lot. I know I did. Not of Medicare age, but it is very good to learn for my mom or for my grandparents. So if you have people in the healthcare industry, maybe your daughter is in the nursing program, send them our link, become a member. You stay updated and invited to everything kupuna related. Next year, I will be joined by Dr. Poki'i Balaz last Thursday of January, which is January 31st, same time, 11:30. And she is an APRN and a DNP. So she's got her doctorate in nursing practice, and what she focuses on is neurology. So she'll be talking about brain health and dementia. So in the meantime, if you have questions or you want to sign up early, send an email to hpgsmembers with an S at gmail.com, and I will get back to you. Also, if you are interested in staying updated and invited, please do consider becoming a member for our 2019 membership season. I'm sure we will be sending out the invites starting December 1st, and that is also when it'll go live on our website. Right now, if you register before December 1st, it'll only be for the half-year registration, so please do wait for December 1st. And I look forward to seeing you all again next year, where we will have our monthly webinars. So January, brain health and dementia. February, we might talk about Medicare again. What's after that? March, we will have advanced care planning. And in April, more about home care, different levels of care that you need, but more specifically, what home care can do for you. So if there are no other questions, then thank you all for tuning in. And please do reach out to Terry or myself with more Medicare questions or concerns that you may have leading up to December 7th.
But I do hope that you found most of it to be informative. And I'd like to get any feedback from you, and we can, I'm sure Mapuana would like that as well.
Yes.
So we can, next time we do this, we can cover the areas that are most important to you.
Yes, that's what we are trying to do, is tailor it to you folks. So as I said before, if you have ideas for future ones or questions related about Medicare, please do contact us and we will get those questions answered. Until next time, thank you for tuning in to HPGS, and thank you, Terry, for being here.
Thank you very much for having me.
Aloha.